Help us pick up the pieces here after what we saw last week. Where does healthcare reform go from here?
Well, we're at minimum on a pause. I personally am inclined to believe that people are rushing to write the obituary on health reform, at least repeal and replace, prematurely. I think there are just too many people standing on one foot with very significant obligations and commitments made for me to believe that we're not going to revisit this in some form later. They're going to move on to taxes now, but once again, you get into taxes, and many parts of what they've been planning on taxes were dependent on health reform. So it leads me to believe that this conversation isn't over. I think we may move into a bipartisan phase. We may see some movement among those who've been holding out in the past. I don't know with certainty, but that's what my instinct tells me.
Do you anticipate we'll have a more policy-focused conversation about this going forward when you look back on what happened here over the last month or so? Did it happen too quickly?
Well, I think there are many who would argue that it did happen too quickly, but then there are those who say if it doesn't happen quickly, it doesn't happen. And I think we just reached a point in D.C. where everyone was just exhausted with the subject. And I think at that point, in our own interactions with people, there are times when we just have to walk away for a while and let things settle, let people kind of chill out and realize where they are. Things become so intense in those environments that it's hard to see above the fray. And I think the pause, at minimum now, is going to be a healthy thing. We'll see where it goes. I think we'll move toward a more bipartisan discussion over time. I think that will bring the far right into the conversation. I think that it will make the policy better.
There was an urgency to the rhetoric about health care reform, as I heard it. You certainly heard that from the president last week. He said there's a risk here we're going to see the law implode and then explode. I think those were his words. Are you worried about that happening? How worried are you about the integrity of that law right now?
Well, the big problem immediately is the fragile nature of the individual insurance market. Action is required between now and June in order to give companies that are putting their assets at risk in a place where they feel like they can continue to offer coverage. Now, the Republicans seem to think that if that happens, the Democrats will get the blame. You know, frankly, I kind of doubt that. I think that the Republicans are in harm's way politically with respect to that. And I think the reality of that is the most immediate concern, and one that is a legitimate and reasonable concern.
How do you go about fixing that? You hear from the CEOs of these health insurers, they say that competition's an issue. Indeed, we've seen a number of them pull out of markets, and in some cases you only have one provider in some. How does the government begin to change that?
There are things that can be done through regulation, and I think the current administration is motivated and to a degree committed to do that. I think there may be other legislative vehicles that could be used. I think the Senate's going to continue to move forward on what they refer to as a 60-vote measure. That is to say, it wouldn't be done through budget reconciliation. And this may be an area where a bipartisan effort could be possible, and that could begin to lead back to more discussions on health care. But that's the most urgent piece. It's the piece that I think President Trump was likely referring to when he said it could implode. There's some truth to that.
Let me just pivot here. You mentioned doing things via regulation. We're expecting some executive orders this week with regard to climate change. With regard to the EPA, you, of course, were administrator of the EPA for a while. How different do you think this agency's going to look under this administration?
I think considerably different. Now, it's easy. Talk is easy in this situation. Actually accomplishing this gets hard. They have to go through a process to use administrative rulemaking. It's not like writing executive orders where you get to decide all the words and you get to throw it out there and have it say what it says. You have to go through very deliberate processes where you propose a rule, then there's comment, then you propose a rule, and once you actually finalize it, it becomes subject to lawsuit. This is a lengthy process, and it's one that is scrutinized at many different levels. So the change may not be as immediate as they would like it to be.
And a last question here, what can this White House do when it comes to climate change in terms of regulatory rollback? What tools does it have at its disposal?
I'm sure they're inventorying those right now because they do have a different view of climate. The tools will involve not just regulation and not just at the Environmental Protection Agency. There are a number of other departments that will have a relationship to that issue, including the State Department.